We are now at the end of the third huge wave of global cases. And what has happened in the last several months is that a series of countries and regions around the world have experienced Delta waves. Fortunately, in any given country, the duration of the Delta wave seems to be about 2 or 3 months.
People are now calling a K-shaped recovery, rapid recovery for high-income folks, but real stagnation for low-income folks, I think, is the fundamental problem that we face in the United States.
Off the top, they're saying for all students overall, the learning loss is projected to be about 6.8 months. For students who are low income, they're saying it's 12.4 months.
There's also gigantic deficits that have been created in terms of mental health challenges that the epidemic's brought up.
The question is, when are we going to be protected, and when are we going to have this pandemic well under control?
I would say we need to think as philanthropists that this is our time. This is exactly what philanthropy can do, is it can look for the holes and gaps, shoring up the NGOs who are out there until the government funding flows.
We're working on a unique concept of how to make a simple ventilator. We assigned some of our best innovators of engineering and manufacturability on the problem. How to make a ventilator quickly that can be produced in mass.
We'll be making truckload of yogurt every single day and ship it to food banks all across the country. We already delivered millions of cups.
And so we launched our Chefs for America initiative, where we were activating teams across the country to be able to get food to those who needed it most. It's a health crisis that has turned into an economic crisis.
I decided to donate $5 million to help support female entrepreneurs, and I'm hoping it will help their families, their communities, and their employees.
The well-being of students, the well-being of teachers, things that often remain an afterthought. Suddenly, they have moved to the center of policy attention.
And so COVID has uniquely brought our community closer together, that empowers all nonprofits to help serve those who are hurting.
How many people are going to accept vaccines? How effective are the vaccines against the variants? How long does immunity last? Is going to tell us a lot about what happens next.
There'll be these ongoing economic shocks. We're going to have at least 3 years here where hopefully philanthropists are seeing some of those needs to fill in, do pilot programs, and speak out about.
I think we have a lot of work ahead of us. I think we can kick COVID into the dustbin of history, but not if we don't recognize in this moment, again, what the possibilities are that we face.
We must focus on preventing the next pandemic. We cannot afford to be back in this situation. And more importantly, we must work collectively to end pandemics altogether.